The Newsday continues here on One News Now. I'm Riza Diaz. DA says it's all systems go for the arrival of 600,000 doses of Sinovac shots in the country tomorrow. MMDA Chairman Benhar Abalos said they are considering the use of carousel bus lanes in EDSA to transport the batch from Villamor Air Base in Pasay to a DOH facility in Marikina. From there, the vaccines will be taken to the Veterans Memorial Medical Center in Quezon City. The vaccines will be delivered in a 40-foot container van, and the agency appeals to motorists to give way for its delivery tomorrow.
Sa mga certain key areas, andyan po ang mga ground personnel namin at hindi lamang yun, nakahanda rin po ang mga towing at emergency vehicles kung sila kasakali. No? Nakasado na po ito, handang-handa po ang mga kapulisyahan at ang MMDA po.
The MMDA has also finalized vaccine allocation from AstraZeneca for 8,000 of its employees. The agency insists MMDA personnel are also exposed to the virus due to the nature of their work on the field.
Minabuti po namin ito dahil alam nyo naman ang frontliners namin, ito yung nasa clearing, ito yung mga nakikita nyo sa kalye, mga traffic enforcers po. Ito po yung para sa protection na rin nila dahil parati po sila exposed.
Now, to further discuss the government's plans, joining us on the line is Marikina City Mayor Marcy Chodoro. Good afternoon, sir.
Risa, good afternoon, and to our viewers this afternoon.
Sir, what systems are in place to ensure the smooth transport of vaccines to the cold storage facility in Marikina City?
As of yesterday, Risa, the Transport Vaccine Group conducted simulation exercises, and they expect a seamless transport of the vaccine from the port of entry up to the storage facility of the Department of Health located in the city of Marikina. They approximated that the transport will take around 40 minutes, and if the vaccine will leave Villamor Air Base by 5, we are expecting it to arrive in Marikina early evening or before 6 in the evening. And let me note the fact, Risa, that it will be the national that will really take responsibility in the seamless transportation of the vaccine from the port to from the airport or up to the DOH facility. What Marikina will simply provide, first is logistical support, and second, traffic management. And thirdly, security in the storage facility. This is basically the initiatives that the LGU will be taking in order to safeguard and to ensure a seamless transportation of the vaccine from Villamor to Marikina DOH facility. And afterwards, we're hoping that it will be deployed and delivered in various vaccination centers seamlessly.
Mayor Marcy, do we know exactly how long will they be kept in the city's facilities?
We don't have really an idea on the side of the local government how long it will be kept in the facility. But my sense on this is that it will be deployed the soonest time possible, since all LGUs are basically ready to roll out the vaccination anytime or any day.
Sir, so will Marikina residents be among the recipients of these Sinovac doses, given that these vaccines will be stored in Marikina?
Yes, definitely. We're expecting that. 2 days ago, we have been coordinating with IATF, the vaccine cluster, for the allocation that the city will be receiving. We are preparing now, and we have prepared some of the listing, particularly not only those healthcare frontliners, but more importantly, our economic frontliners, since we would like to gradually open economic activities, and hopefully to mitigate the effect of the pandemic induced recession that we have been experiencing now. So we given the new priorities to include economic frontliners as well as those in the healthcare and frontline of COVID response.
Sir, do we have any information as to when vaccines procured by the Marikina LGU expected to arrive?
We're expecting it to arrive anytime. We're hoping that the vaccines arrive by March or by April. But we received yet no definite date from the pharmaceutical.
How about, sir, updates? Can you give us any on simulation for the vaccination of residents in your city?
Yeah, we have conducted several simulation exercises for the vaccination of the city. In fact, our mega vaccination facility, it was open 3 or 4 weeks ago. And we have been offering this also for the national government. If there will be other areas that will be needing vaccination area, we could also offer our mega vaccination facility, since it could inoculate around 10,000 individuals in one day, having 10 vaccination centers in the said facility. Since it's a sports complex, it's a 3-hectare sports complex that could accommodate 10 vaccination stations. And we're able to establish vaccinators coming from medical practitioners, from our hospitals, from the uniformed personnel, and there will be some volunteers from the private sector also.
Well, thank you, sir, for your time. That was Marikina City Mayor Marcy Teodoro. The OCTA Research Group says it's possible that the rising cases in the country is due to the spread of a COVID-19 variant. In an interview here on One News, OCTA Research Fellow Professor Guido David explained that the trend is the rising cases is unusual and is similar to areas where a COVID-19 variant was earlier detected. David noted in a Laging Handa briefing that the strain could be the B117 or possibly another strain.
We think there's a possibility that a variant is spreading here. We know that the variant is already in Metro Manila. Now, before some people say that, well, we don't have evidence that, yes, it's correct. We don't have evidence, but based on the trajectory of the increase, this is similar to what we saw in Mountain Province, in Benguet, and in Cebu, where the variant was already also found.
Guido added that the rate of transmission is very concerning as it has been difficult to slow the increase of COVID-19 cases in Metro Manila. However, he said that this shouldn't affect the vaccine rollout in the country. Guido said the main concern on the vaccination program now is Filipinos' hesitancy to get inoculated.
In terms of the rollout, it should not affect the rollout right now. What's more concerning about the rollout is the willingness of people to be vaccinated. That is the main concern. Having said that, the vaccine rollout is important, and it's concerning that there is quite a lot of resistance that we're seeing against this vaccine program, which would really help our pandemic management.
Israel and the United Kingdom have raced ahead the rest of the world in COVID-19 vaccinations. How has the rollout affected the spread of the disease in their countries? Let's find out on this report by Bloomberg.
In Israel, you've done it largely with one vaccine, essentially, so far, right? The Pfizer one. Tell us about that strategy.
So indeed, Israel was fortunate enough to get enough vaccines from Pfizer to allow a very wide vaccination campaign. We, to date, have been able to vaccinate approximately 50% of the Israeli population, when we're talking about the high 90s 90% and more in the older populations, and the diminishing percentages as we go down in age. So really the vast majority of our population at risk now have been covered by what is becoming a 2-dose full protocol for the vast majority of them. And we are beginning to see the benefits of this vaccination campaign these very days, as we see a massive decline in rates of severe morbidity, first in the older age groups that were vaccinated first, and then with about a 3-week gap, we now begin to see the decline also in the younger age groups that began getting vaccinated at a later stage.
Kate, what do you think? When will we start to see this kind of thing in the UK as well? We're obviously seeing cases fall. When do we start seeing the vaccines really kick in?
Well, the data out today actually showing a Scottish study that shows dramatic reductions in hospitalizations from people who've received both the AstraZeneca and the Pfizer vaccine. So actually this very much mirrors the data that we've seen in Israel. And I think we'll continue to see that. I mean, the evidence we've seen in the clinical trials is that these vaccines are highly effective and safe. So yes, I would expect to see both reduction in hospitalization, severe disease, and ultimately we'll start to see reductions in transmission.
We'll be back with more stories after the break. Keep it here on One News. You're still watching One News Now. I'm Riza Diaz. The House Committee on Dangerous Drugs has temporarily suspended its investigation into the shootout between the PNP and PDEA last Wednesday. This comes as the National Bureau of Investigation starts its probe on the incident under the order of President Duterte. Committee Chairman Robert Ace Barber said their decision to suspend proceedings scheduled on Monday came before the President's order. The panel is not closing its doors to possible legislations related to the incident should results of the NBI probe prove to be lacking. Now, the long wait is over as President Rodrigo Duterte finally signed the Coconut Levy Trust Fund into law Saturday. The new law creates a trust fund for coconut farmers from the multi-billion total levy funds collected from them under the regime of former dictator Ferdinand Marcos. Now, under the law, the Bureau of Treasury will transfer 10 billion pesos to the trust fund in the first years, another 10 billion pesos in the second year, and 15 billion pesos for both the third and fourth year, and 25 billion pesos for the fifth year. House Speaker and Marinduque Representative Lord Alan Velasco welcomed the signing of the law, calling it a monumental moment for the country's more than 3 million coconut farmers. Senator Kiko Pangilinan, or Francis Kiko Pangilinan, meanwhile calls for continued vigilance to ensure that more than 100 billion pesos in cash and assets will be spent judiciously. Now, for more updates, visit News 5, The Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. We are One News.